Live on JoyNews desk, let's take you immediately to the Ashanti region where Dr. Emmanuel Tinkwine, the director of the Ghana Health Service there, is addressing the public.
Now let us look at the current situation. The new cases from 19th to 25th July stands at 783 cases. The active cases, as I said previously, is 1,135. Those we are managing at home is 1,109. Now, the situation in our treatment centers. So far, we have 11 on admission with severe form of the disease. 7 are moderate, 5 are mild, and then 3 are critical. So far, 2 treatment centers are working. That's Komfanoche and then the Kumasi Sub Hospital. This is the staff so far infected. We have 151 doctors. That accounts for 9.5% of the infection. Nurses are 868, 54.4. And then all others, 576. That stands for 36.1%. Now let us look at the situation in Ashanti. This graph represents the first wave that peaked between June and then July 2020. That is the first wave. We are recording an average of 100 to 200 cases a day during this wave, exactly about a year ago. And then the cases we were able to manage due to hard work that we put in, and the cases went as low as 8 cases during the week 41 in December 2020. So we went low, all due to the hard work that we put in, the measures that was taken by the government. And then we moved into the second wave. Second wave was between January and then February 2021. We all know what happened during the Christmas activities. And then we were also recording 100 to 200 cases a day. And then thanks to the efforts that we put in again, we were able to contain the virus. And as at April, that is the week 17 of 2021, we were recording an average of 20 cases in a week. Then look at what's happening here. From June 21st to July 21, we've seen the cases are going up again. That means that we have moved into our third wave, and we are recording a total of an average 120 cases in a day. That is the situation. But the challenge that we have here is that we've identified a new variant. That is the Delta variant. Others call it Indian variant, which is more transmissible compared to the Alpha and then the Beta and others. And considering the fact that we've disregarded the protocol, the safety protocols has been disregarded, and then our vaccination coverage is low, you realize that if we are not careful, the cases will go up. So there's the need for us to intensify whatsoever we've done before and whatsoever we are doing now, so as to contain the outbreak. And I believe that's the reason why we've all met here. As I said, the Delta variant, which is presently in the region, is more transmissible. That's the infectivity is very high. And for that reason, we will need to redouble our efforts as far as adhering to the protocols and then the guidelines are concerned, and then making sure that we all obey the rules and then the regulations, irrespective of the circumstances that we find ourselves. So the funerals, the wedding receptions, the parties, and then what is happening in our community, I think it's a cause for worry. And I believe that when we put our heads together and work together as people, we can contain the virus. So that's the situation here. I believe that you can see the waves, wave 1, wave 2, and then we are rising up with 3. The challenge that we have with the third wave in most countries, African countries, is that most of the third waves peaks more than the other waves. So the third wave is always very severe, and then the infectivity is also very high. More importantly, in a situation where we are dealing with this Delta variant that we know is highly transmissible. So if we don't cut the transmission here, it's likely that it will go up and it will derail the health system. And if we are not careful, it will be very difficult for us to fight it if it gets here. And I think that's the reason why we would need to redouble our effort and then move on. So this is the cumulative curve that we have. You can see how it peaked the first wave. We were able to contain it. We worked so hard. And then during the Christmas, it went up. We were able to contain it, and now it's going up again. So you can see this is the cumulative graph that we have in Ashanti. Where are we getting the cases in Ashanti region? The cases are in Kumasi, Metro, and its surrounding districts. We call it Greater Kumasi. In fact, so far, the areas that we have most cases are Adum area, Abrepo, Forikromu, Forikromu, Kwada. So basically, they are within Kumasi. All the cases are within Kumasi Metro, the Greater Kumasi. So now let us look at the age distribution. We know the majority of those affected are age range between 20 to 39. But if you look at the mortality is high in the aged. If you look at the age range from 70 to 79, you realize that so far we've had a total of 461 cases, but mortality of 10%. So you realize that the cases are usually very severe in the aged, as we keep on saying. Now, recently we've seen outbreaks in some schools in Ashanti region. So far, total of 85 schools are affected. 85 schools. This includes basic and then senior high schools. We've recorded 365 infections in these schools. So far, we have a total of 254 recoveries. Active cases are 111. And as at now, number of schools with active cases is 25. It's always a worry if we get outbreaks in the schools, because the schools are congregate setting. And one infection is likely to spread to the whole school. So it's very important that the school authorities and then the management ensure that the protocols that we've put in place are adhered to in the schools. Unfortunately, this is not what we are seeing in most of the schools in Ashanti Region. Because we were thinking that even if the public is not adhering to the protocols, when you move into the senior high schools where the system is regulated, at least the management, the teachers, and then the school children should at least adhere to the protocols. And that's we are not seeing in the region. It's likely that we will have to intensify education and then encourage the school authorities, especially the management of the schools, to make sure that as far as the children are concerned in the schools, they should ensure that they adhere to the protocols. Wearing of face masks is a must in all the schools, whether you are a teacher or a student. And I believe that the teachers will have to set good example so that the children can follow. So that is the situation with the schools. Now let's look at the vaccination in Ashanti Region. So far, we've immunized 454,897 people in the Ashanti with the first dose. Those that have received both the first and then the second dose is 161,454. You've seen that we have a difference of 293,431. These are those who are waiting for their second dose. So you know that as far as the vaccination is concerned, our coverage rate, the vaccination coverage rate, is very low. And with this low coverage, I don't think if we don't adhere to the protocols, the vaccination will help anybody. Because until you've vaccinated close to 80%, between 60 to 80%, you can't say that the vaccines can help in any way. So the vaccination coverage, as far as the region is concerned, with all the challenges that we are facing, shows that we need to back up as far as the protocols are concerned. So we don't have any choice now. The only choice we have is to adhere to the protocols and guidelines that we already know. The first of the protocols is wearing of the face mask. That one is non-negotiable. It's non-negotiable as far as you are in public, whether you are in public or whether you are in private. If you wear the face mask, it will help you. So for now, our choice number one is to ensure that everybody in this region wears the face mask. And we'll have to make sure that we enforce it. We need to enforce the wearing of face mask. Whether you are in a car, whether you are in a school, whether you are in a market, whether you are walking in public, we'll have to see that you are wearing the face mask. And that is the choice number one. And not wearing it, but wearing it properly. Not wearing it alone, but making sure that you are wearing it properly. Number two is to make sure that we observe social distancing in all public places, in all gatherings, whether being funeral, wedding, church, school, should ensure that we observe the social distancing protocol. And then there's the need to ensure that we reinforce the hand hygiene protocols. It seems that it's also becoming a challenge because a lot of people are no more washing their hands. The Veronica buckets, I don't know where they are. We will need to make sure that the district assemblies and all concerned and all the stakeholders that supported us during the first wave will come back and then support us so we can get enough Veronica buckets and then place them at the vantage points so as to ensure that we adhere to the hand hygiene protocols. And also the cough etiquette. Once the Delta variant is highly transmissible, we have to make sure that we adhere to the cough etiquettes. If you want to cough, you have to make sure that you do it in private, and then you wear your face mask, and that's going to help. Whilst we are waiting for the vaccines to come, I believe that that is the only choice that we have right now. So that's with the vaccination. Now let us look at the challenges that we have. I think the challenges are well known, but challenge number one, I call it total disregard of COVID-19 safety protocols by majority of the public. In fact, last week, as an assignment, I went around visiting so many funerals that's been organized in the region. And I tried to count the number of people who were wearing face masks. And to be very sincere with you, less than 10% of those who were in the funerals were wearing face masks. And as far as social distancing is concerned, there was nothing to write home about. The Veronica buckets were not there. Meanwhile, the weddings were ongoing, the funerals were ongoing, and then other social activities were ongoing. People were eating in public, disregarding the safety protocol. So that is number one. Number two is the presence of this Delta variant in the region. As I told you, we've reported Delta variant in the region. Though Alpha is there, but the reason why we are concerned about the Delta variant is that this is a highly transmissible variant, and it's a new variant. So, even those of us who are vaccinated, we have to make sure that we adhere to the protocols. Other than that, this variant will cause a lot of problems. And then, as I've stated, we also have a low vaccination coverage. Whilst we work for vaccines, it's likely that the first, which is the safety protocols, are adhered to. Let us look at the way forward for the region. We will have to continue the media engagement so as to enable the public to know what is going on as far as the COVID-19 situation in Ashanti is concerned. So we'll continue to engage you. So far, I would like to thank you for what you've done so far. In fact, you've been the backbone as far as the fight is concerned. But what we are hoping for is that you have to continue to support us by sending the message across. We've done it before. We all know the effort that we put in during the first wave. And we were able to bring down the pandemic in Ashanti region. And I believe that if we do same, we will definitely achieve our aim. The vaccine rollout will continue. As the president said yesterday, it's likely that we will get some vaccines, and any vaccine that we will get, we won't deny you. We'll have to make sure that all those who are due will get their vaccination, especially those who are waiting for their AstraZeneca second dose. And then we will need to mobilize all opinion leaders in this region, stakeholders, to support with the safety and then the preventive effort of those of us fighting COVID-19. So, thank you. So let's sit here. I think yes, the next is the question.
TJ, bring here short. Okay, so we are.
And you're live on JoyNews Desk. That was Dr. Emmanuel Tinkran. He is the Regional Director for the Ghana Health Service. Let me take you quickly through some of the figures that he shared because he said, among other things, that the dreaded Delta variant is also very present in the Ashanti region. He also said 85 schools, basic and senior high schools, have been affected. 365 cases have been recorded with 254 recoveries. 25 schools currently have active cases, and 111 active cases are currently being treated. And he said that strict adherence of the COVID-19 protocols should be promoted. That's coming from Dr. Emmanuel Tinkran. Expect more in later bulletins. Okay, we understand he's taking answers to questions now, so let's take his answers to the questions.
It's important as the protocols. Yes, because even if we have the Delta variant in the region and we decide to adhere to the safety protocols, we won't have any problem at all. Because the Alpha and then the Delta, their severity is about the same. But as I said, the Delta is more transmissible. So if, for instance, one person gets it in the school, and because it's a congregate, it's likely that the person can transmit it, and within a short time, everybody will be involved. So when you are dealing with the Delta, it makes the number of cases go up rapidly. And more importantly, if you are in an enclosed setting, as the schools. That's the reason why it's important that we adhere to the protocols and guidelines, especially in the schools, because we know that in the schools, most of the children are not vaccinated. The vaccination didn't cover most of the children in the schools. It covered some of the teachers, but it didn't cover the children. So once we know that they are not vaccinated, it's likely that we need to ensure that the protocols are adhered to in the schools, and it must be enforced.
Can you confirm that the Delta variant is now among the school cases?
Yes, because as I said, the Delta variant is now one of the major variants that is running in Ashanti region. So we have the Alpha, which is the old one that we know. But from the genomic sequences that was done for some of these viruses, we realized that the Delta is also here. And that's the reason why I keep on mentioning that this one is highly transmissible. And for that reason, we will need to be very careful. It's not like the Alpha at all. Yes.
The schools, are we looking at basic or from basic to the university?
It's no, so far we've recorded it in the basic schools, in the senior high schools, and even in the universities. Yes, so once we are getting it in schools, then it means that we need to be very careful. Because we were thinking that the schools is where the protocols and then the guidelines will be easily adhered to. Because that one is an organized place, and there's always a management team that will have to see to whatsoever the students are doing.
And with the affected persons, are they only students or we have other staff in the school?
No, not only students. Not only students. Yes, not only students.
From basic to basic
Yes.
or the university?
We said, yes, the schools, the basic and then the senior high schools. So far, we've had some infection in the university, but that one, it keeps on happening. Yes. But this particular 85 is for the basic and then the senior high schools.
Ibrahim, then maybe not the Delta country.
Oh,
Is it true that those who have gotten 2 doses are still recording?
Yes, as I told you from the beginning, the fact that you've had 2 doses doesn't mean that you are totally immune. It only reduces what? Your severity. It builds your immune system to reduce the severity of the infection and also prevent mortality. So don't go and say that, oh, I've been vaccinated 2 doses, so I can go about doing my normal thing. No. Even if you're vaccinated with the 2 doses, you have to make sure that you adhere to the protocols, because our vaccination coverage is low. It's not up to the level of herd immunity that you can say that everybody has been vaccinated. So you can just go about and disregard the protocols. If you do that, it's likely that we may have a very severe condition in the sense that you will get other people infected and then you can transmit it to other people who are not vaccinated.
In terms of the school transmission, we must be worried as a health directorate. What are the pragmatic steps, measures that we are taking to control the spread in schools? Are we looking at probably vaccination of the schools in the region be another measure to control the spread?
If you look at the vaccine rollout, there's a possibility that the school children will also be covered. But it's part of the rollout. As at now, it's not their turn. But once it's not their turn, then what we need to do is to make sure that the school authorities will have to ensure that once the children are in the school, they are protected. And I don't think it's difficult at all, because all that you have to make sure the children does is to make sure that everybody is wearing what? Face mask. And you can always identify people who are not wearing face mask. When you go to the class, the teachers can easily recognize those who are not wearing face mask. If the teacher himself is wearing, it's known. So that means that the management will have to make sure that this is done. Because as I said yesterday, as I went round the funerals, I easily saw those who are not wearing it. So at least if you are maybe the head of the institution, you can go around from class to class and see whether the protocols are being adhered to. And I don't think this is a difficult work to do at all. You can easily supervise it. Once it's a congregate, once it's an organized group. So I think that dealing with COVID-19 in the schools is much more easier than dealing with the public outside. So all that we have to make sure that the school authorities will have to ensure that the protocols are adhered to once the children are there.
So in fact, the health directorate is relying on the support or counting on the support of the school authorities.
This is exactly what we are doing. There was a partnership between Ghana Education Service and Ghana Health Service. And this partnership has been there since the inception of the pandemic. And that's all that we are saying is that let's make sure that those things that we were doing previously are revisited. And I don't think this is difficult to do. No.
Jonathan.
Yes, sir. So you must have been briefed or visited our treatment centers.
Yes.
What is the current state now?
The current state, as I said, we have a total of 26 admissions. 14 are now in Kumasi South, and then the rest are in Komfanochi. As I said, it's only 2 of the centers that we're operating so far, and we've not reached our capacity as far as the cases are concerned. But the worrying situation is that we are getting some critical and then severe cases. So that means that we need to be very careful. Yes. So that's the situation with the treatment centers. It's likely that when the cases go up, we will reopen the other centers, like Frimpong Boateng, and this time we are even hoping to go to Old Bekwai Hospital. We've moved to the new site, so the old one is still there for us. It's about 60 beds. So that means that the Old Bekwai Hospital, we can refurbish it so as to take some of the cases in event we get more cases. So far, that is the situation. We have the case management team ready to support us.
Yesterday, the president made mention of the funerals, organization of funerals, 2 hours. And the other day when I spoke to you, you proposed supervised funerals, 2 hours. How are we going to do this in Ashanti Region? How do we ensure that with all the numerous funerals that we have in the region, the health directorate and the police are able to check and ensure it falls within 2 hours? And secondly, with this message, how will the physically challenged people, the deaf and the other people, also get to know what is happening here?
Thank you. With the funerals, I think it was stated clearly by the president. It's 2 hours. And not only funerals, the weddings, the church service, and then other social events, not only what? Funerals, all social events, the maximum is 2 hours. And he stated clearly that there is no reception. The reception is eating, dining, and then drinking and those things. And this is where we have the challenge. Because the moment people are eating and drinking, the next thing you have to do is to remove your what? Your face mask and then start talking. And that is the super spreader. So the challenge is how to make sure that we adhere to the protocols, the 2 hours for the funeral, and then making sure that if you want to feed them, you can prepare a takeaway pack and then give it to them. They go and sit somewhere, or they go to their houses and then eat. But we wouldn't like a situation where people are grouped together and they are eating, because that is one of the challenges that we have with this fight. Even when you go to restaurants and other things, you can go and buy the food and then come and hide somewhere and then eat. But if you go as a group, you go and sit down and then you eat, you drink, and you talk. Next time you see that the cases are going up. So this is one area that I think we will need to, as I keep on saying, you can do any social event and then make sure that you adhere to the protocols. Even if it's funeral, social distance you can do in funerals. It's not difficult to do. Wearing a face mask, is it difficult to do whilst you are in the public? No, it's not. Washing of hands and other things is not. So as far as I'm concerned, I don't think the protocols are too difficult to adhere to. It's just that people have their own perception as far as the disease is concerned. And for that reason, what they are doing is just to disregard what the government is saying, because these things are not difficult to do. As I said, yes, on Saturday, I visited 4 or 5 funerals just to observe what's going on. All that I can say is that it's blatant disregard as far as the protocols are concerned. And that is where we want enforcement to start, so that the organizers of the funeral, the police, and then the health authorities will have to work together to ensure that this is done. Yes. So sometimes I'm encouraging the police also to move into some of these funerals. Yes, as they always do. Yes. Also, when they get time, they should go. The police should go and then see what is happening, and then call the organizers to book. I'm sure when the police start doing that, by all means, the organizers of the funeral will sit up. So that is when, and if you have any problem that you want the health authorities to help you, the organizers can always see us. Our DHMTs are there. They are always there. If you call on us, we will come and give you whatsoever support that you need as far as the organization of that funeral is concerned. We've done it before. In Ashanti Region, some of the organizers do call me, and then I direct them to the district directors, and they support them to organize some of these programs without any problem. But what I'm saying is that if you do all these things, reception is what? Prohibited. Because that, during the reception, that's where we get most of the what? Infection. It will never be allowed in the region. The disability. Yes, it's unfortunate, but that's one of the challenges that we also have dealing with the disabled, as far as communication is concerned. And that's where we will also need your support. Because as far as the health system is concerned, we've not built our capacity in such a way as to communicate in the sign language. So sometimes we will need your support. But what we will do as a region is that we will have to get somebody who can come and at least during our media sensitization, sit close to me and also do as we always do as far as the presidency and the other places are concerned. And that is with the deaf. But the blind, that's also another area that I think we'll have to address, because it's very important we also address the issues as far as the disabled is concerned. Yo, me say. Chi.
And that's Dr. Emmanuel Tinkran, the Regional Director for the Ghana Health Service in the Ashanti region. And he brings us the end of News Desk for today. Bernice Abobedu comes your way with Joy News today at midday. That's a major bulletin for the afternoon. But up next is Mapito Sabidi with Joy News Interactive. See you tomorrow. And for more news, log on to myjoyonline.com.